Air pollution is the world's biggest environmental health risk, causing at least 1 in 8 deaths around the globe, the World Health Organization has said. The assessment was reached at the first ever discussion on air pollution and its health impacts at WHO's World Health Assembly, which concluded in Geneva last week. Delegates at the Assembly adopted a resolution to address the health impacts of air pollution. The new estimation significantly increases the threat posed by air pollution and has dire health implications for countries such as India, where pollution load is high and public health infrastructure underdeveloped. WHO had last year ranked Delhi as the most polluted among the 1,600 cities across the world, worse than Beijing, which had previously held the dubious tag. WHO's assessment points to a huge surge in disease burden and deaths due to air pollution exposure. Deaths due to air pollution, which include outdoor as well as indoor pollution, have increased fourfold across the globe over the past decade. The latest data shows, while the total number of deaths due to air pollution is pegged at 8 million every year, data shows that China and India are by far the worst affected countries. Of the 8 million deaths globally, 3.7 million are from outdoor or ambient air pollution, the data shows. About 88% of premature deaths due to air pollution exposure occurred in the low and middle income countries, and the greatest number in the Western Pacific and the Southeast Asia regions. According to International Agency for Research on Cancer, IARC, outdoor air pollution is carcinogenic to humans. The agency specializing in cancer research has found evidence that exposure to outdoor air pollution causes lung cancer, as well as there is association with an increased risk of bladder cancer. The latest resolution passed during the 68th World Health Assembly called for all countries to develop air quality monitoring systems and health registries to improve surveillance of illness due to air pollution. In rural areas, reducing outdoor emissions from household, coal and biomass energy systems, agricultural waste incineration, forest fires and certain agroforestry activities can lead to a potential reduction in air pollution. The WHO assessment says reducing outdoor air pollution also reduces emissions of CO2, carbon dioxide, and short-lived climate pollutants such as black carbon particles and methane, thus contributing to the near and long-term mitigation of climate changes. At its next assembly, WHO will propose a roadmap for an enhanced global response by the health sector that reduces the adverse health effects of air pollution.